NHS England has set its members the goal of being paper-free at the point of care by 2020. In order to achieve this, transition must begin now. CCube Solutions offers NHS Trusts the tailor-made systems, training and support they need to embrace the digital revolution. We went to see how going paper light can help reduce the heavy workload.
NHS trusts across the country are having a clear-out. The move away from paper to digital records is one of the biggest overhauls in its history.
A trolley full of patients' written records is a common sight in hospital corridors across the country. But with new systems allowing digital storage of records and instant access to patient information, the trolley could be consigned to history.
Milton Keynes Hospital Trust has been reducing its paper load for several years now, in close partnership with CCube Solutions, a company who believes strongly that their electronic document managing system, or EDMS, will help businesses manage their information overload more effectively. New files are created within the system, while old documents are scanned and digitised into the programme. Head of Patient Services, Felicity Medina, says there's a lot less paper moving around the trust these days.
At any time within the trust, when we had paper records, there could be between 5,000 to 10,000 moving around the trust, or stored within offices. Somebody was reviewing them. Daily, our record staff would transport about 1,000 a day around the trust. So that was a significant amount of their time to go and collect the files, bring them back, file them into the library. Whereas now within the scanning bureau, we measure it in images, so we scan 30,000 images a day.
The financial benefit of converting to electronic records has been significant.
Approximately £500,000 a year cost saving. We reduced our staffing by about 35% in medical records, and we were spending a significant amount of money on archiving of historic records as well.
And the staff spend less time chasing missing files.
Accessing patients' electronic record, and this is a very easy way for clinicians and nursing team to access the patient notes. You simply log into the system with your own password and then use the patient's MRN number to access the record, and it's very quick and easy.
How would you have accessed this before?
With great difficulty. Previous to having the electronic patient record, we would have to have contacted medical records and asked them to locate and bring to us the patient's medical notes, which could be problematic at times if they were misplaced or misfiled.
The versatility of EDMS allows you to decide how best to use it. Some hospitals choose to leave their historic notes in paper form, but to cut down on adding yet more to the pile.
Any form is an electronic form, and you're able to input data into that form. And there's also a database at the back, so if you want to interrogate that data at a later date, that's a huge bonus for people.
St Helens and Knowley Trust were the first to go paper light. Director of Informatics Neil Darvill pioneered a design with CCube which meant the hospital hasn't used paper patient records since late 2010.
The primary benefits are in patient safety. So you're able to facilitate the delivery of all of the medical history to the particular clinician when the patient presents, whether that be in an outpatient context, which is more scheduled, but actually it really works exactly the same way in an emergency context. So a patient coming into emergency department, even if the patient's unconscious, there can be a process of getting instant access to that patient's history without any of the delays.
The immediate benefits of resolving the paper problem can be clearly seen. A greener environment, greater cost savings and improved patient care. An NHS equipped for the 21st century.